It was just past 9 at night when her water broke. Sierra Johnston was about to give birth to a baby girl named Adelaide. But there was a complication.
Initially, I was supposed to go to Sagwa, but because she was already, I was already ready to push, the ambulance just rushed me here. And by the time we got here, her foot was already sticking out. Yeah.
Sierra was going through a breached birth, and she and her partner, Aaron Rolinski, were delivered into the care of GRMC's experienced neonatal and OB teams.
Of course, they had to rush her down here. We were really nervous and all, but we knew that she was being taken care of.
A breached birth presents special problems because the child's head can sometimes get stuck on the way out, reducing the supply of oxygen, which could cause damage to the child's brain.
My only concern was that she would be okay by the time she was out, because I know she was stuck for a while.
This was a precipitous breech birth. So the mom came in, the feet of the baby was already hanging. So they had no choice but to just continue the process. But during the process, the head was stuck for a while. And then when the baby came out, she had initially some movement, but then I noticed that there was not much crying.
To avoid the risk of permanent damage to her brain, GRMC neonatologist Dr. Vanessa Consina knew that baby Adelaide's temperature needed to be brought down to about 33 or 34 degrees Celsius. That's less than normal. She quickly took advantage of one of GRMC's advanced technologies to begin that cooling process.
The problem or the issue that the baby had is what we call hypoxic ischemic encephalopathy. Basically, the baby had neurologic issues because of decreased oxygen in the brain. So what happens is, this is the cooling machine, and it is connected to a blanket, which is the cooling blanket as we call. And this machine is connected to a thermometer that's also connected to the baby. So what it does is, whenever, basing on the temperature of the baby, it cools down the baby using cold water that's inside this blanket.
The cooling must be initiated within 6 hours of birth, and it must last for 72 hours. Throughout that period, the baby needs to be closely monitored for any signs of seizure, bleeding, or breathing difficulties.
The baby was cooled within an appropriate time. And the appropriate time that has been identified is within 6 hours of birth.
And you were able to do that in this case?
In her case, we were able to do that around 3 hours of birth.
We loved the nurses that took care of her. They really loved her.
We're very thankful that they took good care of her. We kind of developed a good relationship between the nurses here. So they kind of see Addie as one of their own.
So far, she's meeting all her milestones at this age. So I am pleased with her outcome.
I'm relieved that they rushed us here. It was a blessing, because at least she was able to be seen on time and taken care of right away.
Complications can occur during any birth, and the GRMC OB and NICU teams are here to overcome them. To learn more, call GRMC at 645-5500.